Physiology 3G, and this video will provide a general overview of the definition, function, organs, anatomy, and physiology of the respiratory system. We also included some facts that might help you to study and learn. Wherein, in an anatomical terminology, the term respiratory system is also known as respiratory apparatus or ventilatory system. Are you ready to listen? Are you ready to learn? Come on, let's go!
Hello guys! I'm here this afternoon to talk to you about the definition of respiratory system. So, respiratory system, it is the network of organs and tissues that help you breathe. Meaning, it includes your airways, lungs, and blood vessels. The muscles that power your lungs are also part of respiratory system. These parts are work together to move oxygen throughout the body and clean out waste gases like carbon dioxide. In addition, the respiratory system, which includes air passages, pulmonary vessels, the lungs, and breathing muscles, aids the body in the exchange of gases between air and blood and between the blood and the body's billions of cells. Most of the organs of respiratory system help to distribute air, but only the tiny group like alveoli and alveolar ducts are responsible for actual gas exchange.
Our body requires oxygen to function properly, so the respiratory system is responsible for removing carbon dioxide, which is a cellular waste product. It also contributes to the body's acid-base balance. Non-vital tasks such as sense and voice production are also performed by parts of the respiratory system. Breathing, or the movement of air in and out of the lungs, is used to accomplish this. There are 5 functions of respiratory system. These are gas exchange, which the respiratory system must help in removing the carbon dioxide from the body during exhalation, and oxygen is absorbed during inhalation. Breathing, the nasal and oral cavities are used to breathe air, which is the nose and the mouth. It enters the lungs via the pharynx, larynx, and trachea. The air is then exhaled, returning to the same path. Next is sound production. Air flows from the lungs through the larynx or voice box during exhale, and muscles in the larynx move to the arytenoid cartilage when we talk. The vocal cords, also known as vocal folds, are pushed together by the arytenoid cartilage. When the cords are pressed together, air passing through causes them to vibrate, which produces sound. And next is olfactory assistance. The olfactory system, sometimes known as the sense of smell, is the sensory system that allows us to smell, or olfaction. Olfaction is one of the unique senses that has been linked to distinct organs. And lastly, protection. Protection from dust and microbes entering the body through mucus production, cilia, and coughing.
Good day everyone, my name is Abigail Ocana and we will be talking about the parts of the respiratory system and its function. Here's the parts of the respiratory system. To discuss their function, we're going to join the oxygen molecule and its path towards our body. Air enters the body through the openings of the nose known as the nostrils. Our nose is lined with the hair and mucus that filter warm and moisten the air that enters in our body. In addition to that, the mucus in our nose and nasal cavity moistens the air to keep our respiratory organs from drying. From the nose, the air continues its journey to the pharynx. The pharynx is also known as the throat. It is the molecule pipe that connects the nose and mouth to the larynx. The pharynx is also known as the throat. It is the muscular pipe that connects the nose and mouth to the larynx and esophagus. After the pharynx, air molecules pass through the larynx. It is just a short airway that connects the pharynx to the windpipe. It is also known as the voice box. At the end of the larynx, there is 12.7 cm tube known as the trachea. The walls of trachea have ring structure to keep it open. It is lined with the tissue containing hair to trap dust and prevent them from reaching our lungs. In the chest cavity, the trachea or the windpipe is divided into two branches, known as the bronchi. In the chest cavity, the trachea or the windpipe is divided into two branches, known as the bronchi. Air will enter into either bronchus since both are connected into the lungs. In addition to that, each bronchus is further divided into many small tubes, known as bronchioles, and each end of the bronchioles are air sacs. Air sacs are also known as alveoli. They are surrounded with capillaries where gas exchange happens. In this way, we can take in a large amount of oxygen and release a large amount of carbon dioxide, which is our waste in our body. These processes are all housed in our lungs because they are the major respiratory organs of the respiratory system. They are the pair of large spongy organs found in the chest cavity. Breathing is a mechanical process wherein air goes in and out of the lungs because the air pressure difference. That's all for the parts of the respiratory system and its function.
Good day to everyone. I'm Kirsten and I will be discussing the anatomy of the respiratory system. The anatomy is divided into two parts, upper and the lower tract. The upper tract is the organ outside the thorax. It is the nose, the pharynx, and the larynx. And the lower respiratory system or tract, the organ within the thorax, the trachea, bronchi, bronchioles, alveolar duct, and the alveoli. The ultimate function of the respiratory system is gas exchange. This gas exchange consists of obtaining oxygen from the atmosphere and removing the carbon dioxide from the blood. It is important to consider that the oxygen is necessary for normal metabolism and the carbon dioxide is a waste product of the metabolism.
Ventilation, the most readily observable component of respiration, involves the act of breathing, during which the lungs are provided with air through inhaling and carbon dioxide is removed through exhalation. While it may seem a simplistic process, the ability of air to flow out of the alveoli is dependent on a number of factors including integrity and compliance of the lung tissue and resistance to airflow within the airway. The perfusion is the second component of respiration. This process involves the circulation of blood through the capillaries, which facilitates nutrient exchange. External respiration requires adequate delivery of blood to the capillary beds of the lungs via the pulmonary circulation. Diffusion, it is another important method of transport within the body and is the third component of respiration. Diffusion involves the movement of a substance in a solution, liquid or air, from higher concentration areas to the lower concentration areas.
Respiration is the act of breathing. Inhaling, the act of breathing in oxygen. Exhaling, the act of breathing out carbon dioxide. Inhalation and exhalation are how your body brings in oxygen and gets rid of carbon dioxide. The process gets help from a large dome-shaped muscle under your lungs called the diaphragm. When you breathe in, your diaphragm pulls downward, creating a vacuum that causes a rush of air into your lungs. The opposite happens with exhalation. Your diaphragm relaxes upward, pushing on your lungs, allowing them to deflate. Respiratory physiology is characterized by two linked processes, oxygenation and ventilation. Oxygenation refers to the addition of oxygen to the bloodstream from the air, which is typically at a concentration of 21%, also known as the fraction of inspired oxygen. Ventilation is the clearance of carbon dioxide from the bloodstream after the latter has been generated from cellular respiration. It can help to think of these two processes as entirely separate, although in reality, this abstraction breaks down in extremely low-minute ventilation.
Don't tell me you're fine, 'cause I know you're not. Just practice the procedures that you're taught. I know you're losing so much needed sleep. Our hearts are all scarring from this disease. Why? We're hurting so much and it's only increasing. But I can hear the crying for love that everyone's needing. Don't worry, don't stress, it will be okay. We can sort through this mess, 'cause it's never too late. Look how far this world has come, and if we come together, we could have this battle won. I know this sickness has got us down. It's breaking our hearts and smiles upside down, but there's still hope in each of our souls. So let's just come together to reach our goal. This torture has brought our spirits down. I understand there's caution in every town. We all feel locked in a prison of pain, and I know you think this is how it remains. We're hurting so much and it's only increasing. But I can hear the crying for love that everyone's needing. Don't worry, don't stress, it will be okay. We can sort through this mess, 'cause it's never too late. Look how far this world has come, and if we come together, we could them.